Welcome to the multilateral Symposium on IVD and SMART Diagnostics. It is an honor to have such a distinguished group of experts and professionals gathered today to explore the latest advancement in vitro diagnostics and SMART diagnostic technologies. Throughout this symposium, we'll discuss the innovative solutions that are reshaping the way we approach diagnosis and treatment, improving accuracy, efficiency, and patient outcomes.
I enthusiastically support the idea and it has come at the right time, especially those of us in resource-constrained environment. And so I wholeheartedly welcome the idea of AI. It's innovative and it can help in several aspects of healthcare.
If I can speak to a force that I don't see and believe in the directions that force will give me, what makes you think that if you properly introduce AI through the right channels to even the layman in the remotest of the traditional communities, we will not accept it?
AI is here to stay at this point. Even though the initial startup costs can be a little bit off-putting, the returns on investment is actually very great, or it supersedes the initial cost in the long term. As at this point, integrating AI into our healthcare system is going to simplify a lot of things, especially in the laboratory diagnosis of a lot of diseases. Most of the tasks are very monotonous and then they yield very regular, predictable data. Using this data to train AI to essentially automate these tasks is going to make it simpler, faster, more efficient, and it's going to free up specialized hands to tackle more sophisticated tasks instead of having them do the mundane. Once you give these mundane tasks to AI, of course, they are going to be more productive given the fact that they're going to work in the same number of hours. They are going to be way more productive if you take up that load, the very monotonous, very mundane tasks of them, and then essentially subject AI to the torture of having to do all of those things.
She's aware that some of the systems are very expensive here in Africa. So Hcowa will partner with people that would like to join us and then we'll subsidize it. So the focus is not Africa per se, it's global. So wherever you are in the world, you can be able to access adequate healthcare for you through the use of AI. So she really wants a collaboration with hospitals, health facilities, so that they can work together with that. Because if she has the ideas and she doesn't have you on board, then really she wouldn't be able to proceed with anything.
Yeah, exactly. So we, the Health Community of West Africa, seeks to expand and advance healthcare across West Africa and in the continent as well. Currently, we have 3 plans or initiatives that we want to enroll. The first is to establish medical departments across hospitals in the country. The second is to establish a national disease control system using big data. And the third is to establish an AI medical supply chain of all hospitals that enroll on our project. And we know that with this, we could be able to take full advantage of artificial intelligence to promote healthcare across West Africa, of which we're starting in Ghana.